Thank you so much, Tyrell.
And I'm going to monitor the Rose and I decided I could monitor the chat so that, we can bring in things when there are moments for comments or questions.
Can someone remind me how to go in? Oh, slideshow. Thank you. Okay, well, thank you so much. Through the Looking Glass, I feel really grateful to know you all considerably well, and many of you have even been able to come to my earlier training at Through the Looking Glass. So this is part 2 of the training. It's looking at the ethical implementation of outdoor ecotherapy in practice at Through the Looking Glass, with an emphasis on respect, accountability, inclusivity, and accessibility. So specifically, we'll be doing an introduction for how to prepare for an out of the office ecotherapy session with the voluntary minor clients and their families in a community mental health context. And I'll be presenting both from the context of being a PsyD candidate and also being a certified somatic ecotherapist myself. So as I mentioned, this topic of disability-informed ecotherapeutic treatment in community mental health settings is something that I was able to present on it Through the Looking Glass in a really fun and hands-on way. We were in the staff room, and the whole staff meeting room was kind of redesigned into an indoor ecotherapy setting where we had all different types of nature objects and art and collage and music playing to kind of embody being in nature while we're inside. And today we're going to get a chance to shift the lens to thinking about, well, what if we actually wanted to move treatment outdoors? So while this is a topic that I have been researching on a more theoretical level for the last nearly 10 years, what is really pertinent now about the topic is that we have the privilege to actually get to go outside with our clients in a way that wasn't as available before. And so, yeah, as we're thinking about Carrie and those 40 charts, this can be a chance for you to think about your chart that's about to go into CQR and how you might want to also include conceptualizing your time in nature, even if it just be your client's backyard or the park nearby, how that can be a really beneficial part of your treatment in your family therapy. So the theoretical orientation of this presentation is from the lens of ecopsychology. Ecopsychology explores human psychological interdependence with the rest of nature and its implications on identity, health, and well-being. And it really conceptualizes human health and suffering in the context of this reciprocal and interdependent relationship that we and our clients have or lack having with the natural environment. And so ecopsychology from an application lens is called ecotherapy. And while I'll be presenting with these kind of coined terms of ecopsychology and ecotherapy, I definitely want to give credit to where credit is due and name that this theoretical and application is not a new modality. While it is more in like this Western lens, a newer thinking, especially in terms of ethics, this is something that's deeply rooted in indigenous cultures and has historically been a dominant part of thinking about wellness, is how are we connected with nature, or how are we not able to have that access? So ecotherapy, as I mentioned, is the application of ecopsychology. And while that's like a coined term, it's also, being outdoors while you're doing therapy. So in a way, we are all doing ecotherapy if we decide to see our clients in their backyard, if we decide to see their clients in a park, in the community playground. These are already opportunities that we're stepping into the experience of offering ecotherapeutic modalities. So ecotherapy is an emerging therapeutic modality that is grounded in ecopsychological theory, which enlarges the traditional scope of treatment, which includes, teaching. So where we would usually be in a classroom or in our families' homes, now we're thinking about how to expand that service to include the human nature relationship. And ecotherapy is looking at both the healing and the growth that can be nurtured through this healthy interaction with the earth. And so from a really formal way, as providers or interventionalists at Through the Looking Glass, we're looking at how can we invite nature to be a partner in the therapeutic process that we're offering our clients. So the research that I am presenting on is grounded in my dissertation, which was published during my training here at Through the Looking Glass. It was published in December, just last year, and it's titled Nature as a Co-Therapist, Ethical Challenges and Solutions of Psychologists Practicing Ecotherapy. So while this is something I'm really passionate about and can speak to from my own personal and professional experiences, I'm also really going to be presenting the literature and also my original research findings that are rooted from the experiences of psychologists doing this work. So how this applies to us as providers, many of us are following the APA Code of Ethics or other ethical codes that are asking us for a long time to be considerate of things like benevolence, professionalism, respect, social justice. And where our principles have recently expanded is that the Ethics Code Task Force is now working on updating our standards, which will be enforceable. And that now includes the principle of interrelatedness of people, systems, and the environment. So this is, really something for us to kind of hold as professionals as we think about the principles that guide our work, to now include how are we as providers or interventionalists also really honoring and respecting ours and our clients' interrelatedness with the people, systems, and the environment. So my goal as a psychologist and as a somatic ecotherapist, I definitely want to provide direct service in nature. And I feel so lucky to get to go back to seeing our clients outdoors if it feels right for our specific clients. I also hope to continue to offer advocacy as a leader in really speaking to the necessity of clients having therapeutic access to nature for all people, which is something that will kind of star as something to think about in terms of accessibility, making sure that it's not just a modality that's available to a certain subset. And I also love to facilitate nature and wellness retreats, which I've been doing since 2013. So I hope to continue to do that in the future as well. So I'm going to start with a little slideshow that I've made us, because I have always really appreciated how Maria and other facilitators have kind of invited us to visually and mindfully ground into what we're going to be talking about. And if you're not able to access visuals, I have also included a song by my friend Paul Isaac and Amber Lilly called Young Roots. And so that song will also be playing in the background. And so, yeah, feel free to either look if you can or listen if you can. Or if you want to, you can just turn the whole thing off and just kind of bring to mind for yourself, what does this offer you as an invitation for your work? And to give a little bit of vocabulary in the song, two Hawaiian words are said. So I wanted to let you know what they meant. The word keiki means children and kapuna means elders. So there's a line that repeats, walk with your keiki or your children and walk with your kapuna or elders. So as you watch this, I hope you think about your family or your clients' families or your students and their families, and whether you think that these affirmations can kind of inspire thinking about how this opportunity to bring our clients into nature is really a great thing. So I did want to thank different friends of mine who offered images for us to be looking at of their families, just kind of in natural ways in nature.
I hear you calling, chanting your name.
Oops, sorry about that.
I hear you calling, chanting your name. Roots of creation, love's eternal flame. We chant a message, vessels of light, for all of your children.
It's my
It's
godson.
time we unite. It's time we unite.
Another family. So it goes through a series of different families.
Ooh, yeah. Ooh, yeah. Ooh, yeah. Nurturing the young roots grows a strong tree. Foundation for community. Young roots grow a strong tree. Foundation for community. Yeah. Hand in hand, walk with your kiki. Hand in hand, walk with Kupuna. Hand in hand, walk with your kiki. Hand in hand, walk with Kupuna. Yeah, yeah.
These are all images on my
For the
community
next
and
generation, fill them with love, peace and inspiration. Set the foundation for the next generation, fill them with love, peace and inspiration. Yeah, yeah. Yes, I was a young root swinging from my family tree, looking up to the elders that were guiding me. Rain and shine, they helped this little sprout to grow.
So this eldest child is on the ASD spectrum.
So now's the time, friends. Share your wisdom. Young roots will soak up what you give them. Send the shoots on up towards the sunlight and share your sweet fruits. Got us feeling alright. The roots and the shoots from the branches share the fruits.
Here he is practicing
Roots of plenty,
surfing.
feeding many. The roots and the shoots from the branches share the fruits. Yes, share what you got. Nurturing the young roots grows a strong tree. Foundation for community. Young roots grows a strong tree. Foundation for community. Every seed planted starts with young roots. When you nourish it, will grow to bear the sweetest fruits.
This is my neighbor and their
Starts
single
with
bear.
young roots. You nourish it, will grow to bear the sweetest fruits. Every seed planted starts with young roots. You nourish it, will grow to bear the sweetest fruits. Every seed planted starts with young roots. You nourish it, will grow to bear the sweetest fruits. Yeah. Ooh, 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 yeah. Ooh, yeah. We're setting a good example for the children. Cause back to the roots is how we're living. We're eating our food straight from the garden. Building community, cause that is where the heart is. So gather round, meet us at the fire. And bring your family and music to inspire. We'll sing in harmony and sow these seeds together. And when the flowers grow, we'll share them with each other, yeah. Hand in hand, walk with your kiki. Hand in hand, walk with Kupuna. Hand in hand, walk with your kiki. Hand in hand, walk with Kupuna. Hand in hand, walk with your
They
kiki.
just had a second baby.
Hand in hand, walk with Kupuna. Hand in hand,
Another good friend of mine and her twins.
hand in hand, walk with Kupuna. The young roots grow a strong tree.
She's about to have a
Foundation
third
for
baby.
community. Young roots grow a strong tree. Foundation for community. Yeah. Young roots grow a strong tree. Foundation for community. Young roots grow a strong tree. Foundation for community. Yeah. Young roots. Hear you calling, chanting your name. Roots of creation.
This plant was planted with their umbilical cord. Previous image.
We chant a message, vessels of light, for all of your children.
This is their son that they recently lost during the ceremony, bringing them back to the earth.
It's time we unite.
And these are the artists who are singing on their farm, and they recently became pregnant. So thank you so much for taking a minute to kind of ground yourself in the different sensory ways that we just did into what we are talking about on a kind of intellectual academic level. So I'm now going to invite us to take a moment of mindfulness and to bring together to mind a vignette when you have witnessed one of your clients benefiting from contact with the natural world as a resource for their treatment. Or you could also imagine if you've had the opportunity to work with one of your TLG client families outside in a natural environment. And so I'm going to offer some consultation, kind of brainstorming questions. Feel free to write down what comes to your mind, heart, or your spirit, and we'll have a chance to share a few shares if someone would like to. So things to consider in this brainstorm. Can you imagine how outdoor ecotherapy could be beneficial to your services at TLG? What could you do outside with your families? What would you not be able to do? What would you want to do if you could? And of course, through our TLG disability informed lens, I would like us to really think specifically about, are there any accessibility barriers or ethical issues that you foresee affecting our clients and their families, or yourself as an interventionalist when being with families outdoors? So I'm just going to kind of allow us to steep into some of those questions, and then when someone feels called to, they're welcome to share from their heart with a little brevity about, kind of how you could imagine shifting your treatment to being outdoors with this invitation that Through the Looking Glass is giving us to be able to see some of our clients outdoors now.
Rose, can we see the questions again?
Yeah, are you not able to see them here?
I
see them.
Okay, now we can see them.
Okay, thank you. Does anyone know how to go into full screen so you can see just that slide?
I think if you click the slideshow button and start from, so up at the top, click slideshow and play from current slide.
Thank you so much. So yeah, honoring that not everything in those images may or may not have been accessible to the families that you're serving. This is an opportunity for us to think about, well, how could we offer nature as a possible setting for treatment with this new invitation?
Rose,
Mhm.
I have a thought, right? An experience.
Please.
One family I worked with quite a while back, the mom had an intellectual disability, and she had a little guy who I guess was a toddler at that point. And mom liked plants, and so she had a little potted plant garden on their porch. They did have a little porch outside that was accessible to them. And so that became a project they did together, and they walked it together, and the little boy was really into it. And I thought that was a really nice therapeutic thing that they shared, a bonding thing, and a nature, just to nature. Another family I worked with a long time ago, the grandmother lived with them, and she was from, well, she lived in Nigeria and married a man from Nigeria. So she lived there a long time, but she was also originally from the Caribbean. And so she had a tiny balcony in their apartment. And she had all these plants and would make like African food and Afro-Caribbean food. And the two little grandkids, became really part of that, sharing her culture and the outdoors. And they'd watch, the little tomatoes grow and the different things, herb things she had. So those were ways, because they had little porch or balcony, didn't have to have a big park or nature yard, and yet they were really close to cycle of life that way.
Thank you so much for sharing. I imagine that could possibly inspire some of our other families, interventions that we could do with our families, like growing plants and yeah.
I mean, I've also got images of our backyards with the early Head Start, and how the teachers and maybe other staff had little gardens, and the kids would water the plants and tomatoes and cilantro or something, different things growing in our own yard. And the teachers were part of having nature in our own yards there, playing in the water and the sprinklers and the plants. And
yeah, some of my favorite memories getting to be a consultant for our early Head Start was spending time with each of the classrooms in their outdoor halves of the classroom. And yeah, I know Through the Looking Glass has already integrated that into the structure of our early Head Start. So I think that this is going to, offer us a lot of resource as the children come back to our schools and as we get to go back to seeing them outside. So thank you, Sherry, for offering that kind of indoor outdoor example. I think that's really great, especially when we're thinking about accessibility. So thank you. Does anyone else want to share?
Yes, I'd actually like to offer something.
Please.
And it's Maria. So I have a client who, as a quite little child, about 4.5, 5, I think 5, lost his father. And so what we did for a long period of time was to be outside and to share activities that he enjoyed with his father. So a lot of it has to do with twirling things that could go up into the sky. And so we did a lot of play like that. And then his mother and I discussed ways that they could honor this, work through this grieving process also themselves together. And they often enjoyed going to the beach and flying kites and skipping stones. That was an especial thing, to skip stones on water, which he also enjoyed. And so his mother also carried this out as a regular time together that they shared in memory of the father. So just want to also point out, and going to special places in nature where they went together was another part of this picture. And we spent a long time discussing this, then we would draw it and we would recreate it in various ways. I just want to share that as a way of working through grief.
That's so beautiful. And yeah, Maria has offered us a lot of ways to think about also those initial kind of screenings to find out, do your families have sacred places that they historically find resource going to together, or have any memory of going to and sharing a positive experience in? Maybe they can't physically go back to that place with you, but how could you offer that imagery as resource for you in your session and your clients when they're with you? So thank you, Maria. And then thank you for naming the grief work too, that the breadth of the diagnoses that would really benefit from contact with nature is really broad. So while anxiety and depression are some of the most effective, or where ecotherapy has been documented to be the most effective would be pretty across the board for anxiety and depression. And then there's so many other ways that people are impacted, that their connectedness with nature, with the food that they eat, with their environment, with the metaphors that the animals offer us, with the metaphors that the changing seasons offer us. In what ways can we facilitate that with each of our clients, whether they can actually go outside with us during session or not? So maybe we could take a few more shares if it felt alive, or we can also share more toward the end. But I think that this hearing from each other is kind of like inspiration. It's fodder for the fire, whatever that phrase is, that can kind of inspire us if it's hard for us to imagine going outside. Like maybe we're P1s and we've never even, seen our clients yet in person. So it seems maybe like a bigger jump to imagine seeing them outside. So how can hearing from each other about successful experiences, how can that open the door for us to think about this is a real gift of an opportunity to get to see our clients 50% of the time outside?
Can
I think I hear Donna, so I just want to name that, but
oh,
whoever was else speaking, great, Jessica. So just hearing you both going. So Jessica, do you want to start, or Donna, do you want to start?
either way, I didn't hear Donna or see her, but either way is fine.
I can read lips, so I'm seeing Donna saying that that's okay. Jessica, if you're
Okay,
wanting to go, is
thank
that right,
you.
Donna?
I'm
Okay, and then Donna, if you could go right after, and then for other people, to really soak in these shares in thinking about that we all hold our families together, that none of us are there alone serving our families. So even if you're not able to get to see your clients outdoors for whatever various reasons, we can inspire and support each other in our efforts with those who are able to take on that opportunity. Please, Jessica, and then Donna, thank you.
okay, thank you. First of all, I want to start by saying that I find myself kind of really stuck in the thinking of everything that would be all the barriers, really. And especially thinking about a lot of my families who have a tendency, even before COVID, who had a tendency to really stay home all the time and not leave the house and not explore and not even know that they can go on hikes or to the beach or parks or any of that, and that we have so much of it here in California. And so I found myself just even trying to kind of name that or go in that direction and think about and ask about, wanting, if they wanted to go, or, I would hear about how they used to go back in Mexico or wherever, and that now they don't. So there's that indirect kind of trying to promote the contact with nature. And then I had another client, this made me think of she started a mama who started her own garden, and this became like her therapeutic, in the middle of Oakland, and just, and I would ask her, like, part of the self-care was, when I would talk to her, would be, so how's your garden? And, have you had time to tend to it? And sometimes she would, sometimes she wouldn't. So, I think I find myself really having a hard time imagining how to do it and how to make it happen. But these two things came to mind.
Yeah, Jessica, you offer both, which I believe we're all kind of holding that balance between the beginning of Jessica's share about, wow, our clients maybe had access at a future time and now are really feeling like that access is either not possible or just not happening, not coming to mind. So that could be a kind of point of intervention that we're thinking about. And then on that other end of the pendulum, maybe you already have a client that has a garden, and it's about asking how they're tending to the garden and how are they tending to themselves, and thinking about self-care. Jessica is helping us to, remind our caregivers how just that little resource of the garden right outside their backyard can be such a resource during this really challenging time that we are in across the board. So thank you, Jessica, both for helping us to think about and honor the challenges and the barriers that we're holding, that our clients, really do experience, especially with working with families with disabilities, lower resource, and then in spaces that have different environmental barriers to getting that context. So we're not in the easiest situation that we're thinking about this, but that doesn't mean that it's not possible. So I really thank you, Jessica, for just naming, like, oh, at first, all that comes to mind is my worries about the barriers. And I do have a little bit of an in thinking about that garden that is there in the backyard. Sorry about that. So yeah, thank you. And then I'd like to transition to Donna. And then after Donna's share, I'm going to invite us to go and take that imagery of these poignant vignettes that our clinicians are offering us. And then I'm hoping that we can kind of shift into a little bit more of an academic kind of intellectual process of going through the results of my dissertation that offer both really naming the challenges across different domains and offering real practice solutions from psychologists. And then we'll go back into checking in again about, okay, with this information, how could we actually mobilize this as a real practical modality for us? And I guess I want to name, so after Donna, I do want to invite somebody from the EHS team as well. I know Donna's there as the family consultant, so I'm not sure if you're going to be speaking from that role, but it would be nice to also hear from someone from Early Head Start or someone that's not like a clinician, basically, to also be encouraging us all to think about how, even in the classroom, in that outdoor section, how could you, or how have you seen nature be a real beneficial, even if it's just the water flowing in the watering, playing baskets, buckets that you guys use. How have you seen it be something that's something really viable and valuable? So please, Donna, thank you for your patience. And I'll just remind you to take your mute off.
Okay. Basically, I was seeing a family who was living in this unsafe neighborhood.
Sorry to interrupt you, but do you want us to see you? And if so, could we invite you to put your screen? There you go.
Sure,
Thank
okay.
you.
Okay, I was seeing a family that lived in an unsafe neighborhood, and there was a lot of trauma about gunshots. So when they came to the center, it took them a while to adjust to the sounds. And when we met in the little clinical offices, they had problems. And once we went outside, and there was a 6-year-old and the mom, who was a regional center client. But once her son experienced going outside, and they both, enjoyed the outside, and everything just, it was more relaxed. They just really enjoyed it. And after that, we moved their sessions outside and really worked on the trauma.
Wow, Donna, that's such an important and real, and I think relatable scenario that we're all kind of thinking about, in knowing that many of our families are living in circumstances where historically maybe they would have been more afraid to go outside and have real experiences, traumatic memories, or knowings that happened outside, and how that can feel like a barrier to going outside. And then a beautiful way that Donna used that environment of being outside as the container to help her client work through that trauma specifically. So while that's like amazing, I do want to name that Donna probably worked very slowly through that process and with a lot of sensitivity, especially given the history of trauma in nature. So that could also be something that we would think about, like maybe not the best fit at first, and really honoring that Donna probably did a lot of work to help prepare and contain and process with her clients, to being in a place where it continued to feel like a really healing space. So great job, Donna. And I hope that that offers inspiration for us all to be thinking about the different environmental barriers that come to mind, and how in a longer term treatment model like we have it through the Looking Glass, how we can just start going outside and then slowly increase their contact with nature.
Rose, before we shift, there was a comment in the chat from Liz that says she hasn't had the opportunity to work outdoors with her young clients yet. Of course, it's all been remote. But I spend a lot of time with my sons outside. My 6-year-old in particular is very sensory driven. So I do things with texture and dirt quite a bit. Dirt to sift, pour, dig in. mud, putting pebbles or sticks in it,
Mm.
just sensory play with nature stuff. So I noticed in your slideshow, you mentioned there was a boy on the ASD spectrum, and I could see him with this nature and the water and the horse he
Yeah.
looked at or petted, and how nature for people with sensory issues or other disabilities.
Beautiful, beautiful example, Liz. Thank you so much for sharing from your personal experience. And as we think about Liz's share, we can think about how we, there was something, I got goosebumps, Liz, listening to you and the nuances of what you noticed about what was really a resource for your sensory sensitive child. And, the ways that the sand sifting through their hands, or the ways that they were collecting those pebbles. And so what I want us to take from Liz's share is both about encouraging that contact for the client, but also helping the caregivers to notice those nuances of what really provides resource for our clients. And I can share from my own personal experience of being a neurosensory person myself. Contact with nature is such a resource on a day-to-day basis, needing to spend that immense immersion with the natural world as a way to de-stim and to really become present with where I'm at. And so thank you, Liz, for sharing your personal experience. That was really helpful and relatable, I hope, for a lot of us as we think about our kiddos on the spectrum and other ways that we are working with people who are sensory sensitive kind of across the board, if you really think about it carefully. And so if I could invite one more share from the EHS team in thinking about any ways that the way that TLG has situated your classroom to also include that outdoor section, how has that been a resource for you and your kids that you're working with?
Hi.
Hi, Teacher Donnie.
Yeah, I like to say that I know sometimes we have some of the kids that have challenging problems, maybe when they come inside the classroom. But I tell you, as soon as we go outside, it's a total different atmosphere. The kids just light up. It just changes their whole mood. So yes, I see that all the time, Rose, when we go outside. And they just switch just like that. Like, oh, I'm free, I'm outside, I can ride a bike. And the sand is the best for them because they love that, because it's sensory motor. They get to pour it and it lasts forever. It doesn't ever go away. So I notice it. And when you said outdoors, it's like, that's what we do. We're like, oh, it's time to go outside. So, but yeah, it does make a big difference, and it does change the children's whole mood. And I just love it. I love to see them be happy when they go outside, do little stuff, play on the sand or ride their bikes and stuff. So I just want to say I noticed that in the classroom that we have.
Thank you so much, Teacher Donnie. And getting to be your consultant, I can speak to that directly. I've seen our kiddos in Donna's classroom both really benefit from their personal contact with nature, and then also from that more social, emotional interconnectedness with each other level. That time outdoors in the sandbox offers so much learning and sensory pleasure and joy that really brings the classroom together in a sense of we are getting to enjoy this time together. And also I think Teacher Dawn, you named like that moment in the classroom when it feels like we need to go outside. And I think not enough teachers think about that. Like, it can be a lot easier to pathologize the behavior instead of to think about how could changing an environment offer a lot of resource for this presentation. And so thank you, Teacher Dawn, and thank you for everyone who didn't get a chance to share, for bringing these moments to your own minds, and may they feel alive as we engage in this kind of training moving forward. And then I hope that more shares can come to light at the end as we continue to try to bring hope to the practicalities of how to really make this possible with the opportunity of getting to see our clients outdoors again.
Rose,
Yeah.
I just want to tell you that you have a little more than 40 minutes left.
Thank you so much. That's so helpful to know. So yeah, that was a really beautiful moment for us to both share and to consult as a team to think about how could our families benefit from this opportunity. And the goal is really for us as a TLG team to have some more concrete practice solutions for the ethical implementation of outdoor ecotherapy and how to move forward towards seeing our families in person outdoors. So the dissertation research findings that I'm going to be sharing in this training is based on interviews from 10 licensed psychologists who practice outdoor ecotherapy in diverse clinical contexts with diverse clients across the United States. So here you can see my different participants with pseudonyms. My participants are Sycamore, Ash, Bodhi, Willow, Oak. And then there's 5 more on the next page. Sycamore does walk and talk therapy in the forest. They did this practice for 3 years in suburban regional parks. And of their 12 therapy clients, they would see 2 clients a week outdoors. Ash ran a mindfulness-based outcome group as part of their internship training. And of their 20 clients that they're currently seeing, they're not currently seeing any outdoors right now, but they did as a past intern. Bodhi has a unique application of ecotherapy where they choose to facilitate psychedelic experiences in natural settings. And so of the 35 years that they've been doing their work as a psychologist, only 2 years have they kind of shifted into this more psychedelic based ecotherapy setted treatment. And that is for 4 of their 18 clients. Willow does walk and talk in their clinic garden. They've been doing this for 9 years, and they go to any settings at various settings such as churches, a stream, an outdoor playground, a grassy field, a memorial garden, and they see about 2 to 3 of their 25 clients outdoors. Oak is a professor of ecotherapy and offers an ecotherapy certification, and they have seen clients for the last 15 years in parks, gardening, and has also done ecotherapy, but they're not currently seeing clients. They're more of an academic at the moment. Cottonwood does walk and talk, home-based, community-based family play therapy in a park near the client's residence. And this participant is a supervisor, so they're not currently seeing the clients outside, but they are supervising clients. Pine runs an outdoor mindfulness-based meditation group through the VA hospital. So, recognizing that this can also be really informal treatment settings. Papaya runs a residential horticultural outdoor behavioral health program, and they engage in gardening and hikes with their clients in the woods and community trips to the beach and to the gardens. And finally, Redwood does both individual and small groups outdoors in local trails in their neighborhood, in a cemetery near their office, and in regional parks. So I hoped to just share kind of the breadth of the different contexts that this research is grounded in. And my dissertation is 400 pages long, and it is really, it includes all the data that came out of the research. And so it would be way too much to present in 40 more minutes. So of the 16 ethical domains that came out of my thematic analysis, I'm going to be presenting on the 7 that I think are most pertinent to us to be thinking about right now in this very practical step of being asked to see clients outdoors, not really a theoretical training, but more of like, okay, how can we actually get this started? And then on the other side, I was also invited to present at the APA conference this coming summer. So I'll be offering a symposium on some of the other domains that came out of my data set that include reciprocity, so making sure that we're giving back to nature, respectful integration, so making sure that we're really mindful about not appropriating indigenous cultures in our practices, and finally, not pushing a nature agenda, so making sure that we're mindful about which clients would and wouldn't be a good fit for this treatment. So those domains I'll be presenting about in a recording this summer, so you can kind of look forward to seeing that. And then today I'll be really offering those practical domains that offer kind of a how to get started in terms of ethical thinking. So this isn't enough of a training to say like, yes, you should go outside, but I do hope that this is an introduction to the thinking about that decision. So this is going to be a quick summary of my total domains that came out, and the ones that are bolded are the ones that I'll be presenting about. So competence, how to make sure that you have enough training before you go outside. Respectful integration, as I had mentioned, I'll be presenting about at APA. Informed consent, I'll be presenting about today. Screening today. Not pushing a nature agenda today. Efficacy, payment, reciprocity, confidentiality, I'll be presenting about today. Changes to the frame, accessibility, and then there's also recording, assessment and treatment planning. I'll be presenting about avoiding harm, and there's also documentation and liability insurance. So if those non-bolded domains are really what you'd want to be thinking more about, I have an amazingly extensive dissertation to offer for you where you can read me going extensively into each of those ethical domains and offering literature, and also offering quotes directly from the participants. And so it's just really, really rich. There's so much information in there. So if anything is kind of missed in this presentation, I just hope that you know that this is just the beginning of the thinking, and there's so many resources I can offer you as you continue to think about this. So the first domain I'm presenting about is informed consent, challenges and solutions. And here you can see the number of psychologists that endorse these challenges. And you can see that those that are more heavily endorsed are up at the top, and then those more variant solutions that are only endorsed by one participant are at the bottom of each of the subcategories of the domain, either challenges or solutions. So that just gives you a frame for how all the data will be presented moving forward. So looking at specifically at informed consent, you know, we as providers of clients who are minors want to be thinking about how to offer opportunities for our clients who are minors to give consent also to the part of the treatment moving outside. And other people are providing that consent, like their parents. And so you also want to find ways to engage that consent with the child themselves. And that's a challenge that some of the psychologists were talking about. It's also hard to know which clients will actually commit to going outside. They might say they want to, and then they no-show those sessions, so that, you know, you'll want to be thinking about those challenges that have been presented by the psychologists around informed consent. But some really great solutions. 6 psychologists recommend to describe the risks and challenges explicitly to your client, that the most important thing in informed consent is just to let the client be really informed in that decision. And that includes to let them know what could be some of the challenges that you've been considering in this decision. Other psychologists, 4 of them, don't have a formal written informed consent, but they do offer verbal consent. 2 of them have an ongoing consent process. So not only getting that consent at the beginning, but make sure to continue to assess for consent for the treatment to continue to be outside. One participant had a really thorough and formal written consent for the specifics of the treatment moving outside. So that could be something that you'd want to consider. And then in residential treatment, one of the psychologists had an administrative admissions team that had a really extensive informed consent process that included like a 2.5-hour enrollment orientation. So not that we need to go that extensive, but that you really want to, with informed consent, you really want to make sure that you're bringing to mind with your clients these ethical considerations so that they can be informed in the risks that they're choosing and consenting into. and also the benefits. Not pushing a nature agenda is a domain that comes out of the literature that asks ecotherapists to be accountable to not just having all clients go outside, but making sure that there's some real transparency, following your client's lead, and making sure to, you know, if you do offered going outside as a choice, making sure that the client is actually interested in that. And to be aware that 3 out of the 10 psychologists named that indoor treatment would be inappropriate or uncomfortable for some of their clients. So you really want to be holding that in mind as you're thinking about going outside. You could, you know, be sure to be clear in your advertising about why you want to go outside and what that value would offer to your treatment. One psychologist spoke to this concept of biophilia that speaks to with what's within us all, which is that we as human beings are biologically conditioned to want to join with nature. So, you know, in the same way that we don't want to force people to go outside, there is something that's kind of inherent within us as humans that is driven to be connected with nature. So, you know, that could be really aligned with a lot of your clients. Screening. You want to be really upfront and screen out clients, 5 people. I mean, and okay, I do want to, before I share this slide, I want to name that I'm presenting the data of my subset of 10 psychologists. So this is not necessarily things that I 100% agree with. And it's not necessarily representative of what's true and possible, but it is a really great data set for us to begin to think about a pretty strong subset of 10 psychologists and kind of what their thinkings are. So if we want to disagree with some of these, there can be ways that I think that we can, as long as we're really thinking about accountability and accessibility and making sure that the clients are a good fit. So 5 of the psychologists said to screen out clients with severe and acute psychiatric diagnoses. And 5 psychologists also said to really try to listen to, in the same way that Maria spoke to following the client's interests and their history and their culture of being outside, and only then introducing it as an option and seeing if the client is receptive. You do want to be careful to assess your client's physical condition and make sure that you have safety factors in mind. And as Donna offered for us, the really important part that 3 psychologists also spoke to, which is assessing for your client's trauma history or in any negative associations that they have outdoors, because you want to know that before you flood your client. And that's really important, that if that's not how you've been thinking about your screening and your intake, that be a new thing that you bring to conversations with your clients before you go outside. So this is upfront doing before you even make the decision to offer going outside. 2 psychologists, that being said, say, hey, let's just invite everybody, and they don't really think that any client needs to be screened from this modality. So there you're seeing kind of the breadth, right? Changing the frame is this idea of, instead of being in an office, now you are outdoors and either sitting on a bench with your client or taking a walk with your client. So that change of frame offers different challenges that were spoken to. 6 of the psychologists addressed the fact that there are aspects of nature that could really negatively impact the client-clinician relationship. And if there are any of these themes that you want to know more about, like what did these 6 psychologists say when Rose Evelyn said that they were part of this theme. And you could go back into my dissertation and read the exact quotes from my interviews that I use to kind of back up this theme and to make sense of and to offer more information around. So I'm just kind of giving a pretty broad overview of the themes that came up, and you're welcome to go back and learn more if it feels pertinent to your clinical work. It could also negatively impact your client. They could get stung by a bee, they could trip and fall, they could, like Donna mentioned, they could, you know, feel flooded and feel triggered in that environment that was once where they once had a traumatic experience. And then the informality of being outdoors in this way could conflict with some of our clients' view of therapy. So that's something that we're wanting to kind of talk to our clients about up front before we just take them outside. And something else to think about in the change of frame is that you could run into some of your clients' friends or someone that you know yourself outside. Also, some solutions that were offered by the psychologist is to really discuss this shift ahead of time with your clients before you go outside. Have that phone call with your families about what that would look like before you make that decision, so that when something comes up, it can be something that you've already kind of problem solved with them about. As the interventionalist yourself, you're also wanting to make sure to be aware of and in integrity with your professionalism and your boundaries of the therapeutic relationship. There can be a kind of shift into a more informal setting when you're outside. So you're still wanting to make sure that you're maintaining that professionalism and that your boundaries maintain like a real clinical integrity as you're outside, because it can be easier for clients to start to relate to you as a friend. So you're really wanting to shift and just continue to contain while also be relatable. And some solutions continue to be, here's some individual suggestions to have different options of outdoor containing environments. So you might say, that your client lives here. You might do a quick Google map to think about, okay, well, there's a park, or there's like a small strip of grass 1 block away, and 3 blocks away there's a park, and 10-minute drive away there's a water view, and to think about which environment is containing for your clients, and to be intentional about what settings outside you're choosing to go into. With younger child clients, you're recommended to set some pretty clear rules and expectations, like making sure the kids know to stay within your sight when you're outside, because they could run a lot further. Adult clients are more familiar with the therapeutic frame, so it's easier for them to maintain that frame outside. A female clinician has chosen to only take female clients outside due to their fear of erotic transference, something to be considerate of. One psychologist's suggestion was to summarize the process at the end of each session, to really summarize what happened and how that environment was conducive to the treatment. And to be aware that some of your sessions will go beyond that 50-minute frame that you may or may not be used to. That it can be a real liberating place for your clients and yourself. So that's something to think about as a positive solution. Confidentiality, we're in more limited private environments. And so you really want to be thinking about what impact is the importance of confidentiality in the treatment of the client you're working with. And with some clients, it's less, and some clients, it's more relevant. So you're wanting to really think about and discuss with each client those variables. One barrier is that some child clients may not really understand that idea of confidentiality, so it can be hard for them to discuss how they feel about it. So you're really wanting to slow that process down with them. You may also run into someone you know. But some great solutions is to make a concrete plan about how to proceed if other people are around. 7 people talked about that. So I think that's definitely something we want to be thinking about, is just very likely you'll run into somebody that either you know or somebody else knows, your client knows. So how are you gonna navigate that when that happens? 3 of the psychologists suggest to never disclose what the therapeutic relationship is if you run into somebody. So that's something to think about, how the client wants to introduce you or not introduce you to that other person, or how you want to engage with your peer or colleague when you are with your clients. Site finding, you want 3 of the people said to choose outdoor spaces with few people around. 3 people said that if others are nearby, to just entirely stop talking while they walk past, where a different 3 psychologists said, well, actually, if somebody's nearby, you can keep talking and just kind of keep it brief and light what you're talking about. 2 of the psychologists say it's really important to choose outdoor spaces that ensure that nobody is nearby. 2 psychologists suggested to be sure to never address their client by their full name in a public place. And some other variant solutions include to debrief with your child client through the play therapy after running into someone outside, to really offer that child client a space to process what it meant to run into their friend. And then at an organizational level, we can be thinking about building or structuring spaces that promote confidentiality. One clinician suggested considering going to a location different than your client's direct neighborhood. So I don't know if that's feasible for Through the Looking Glass, but that is something that we can be thinking about, is do we need to meet them in their home or even in their direct community, or is there an adjacent kind of nature outdoor setting that we could be meeting in? These are things that Through the Looking Glass will probably guide us through understanding more as we make these decisions. And then the veterans that were in this study said that they didn't mind being heard or seen or by other patients at the VA. So that's something to think about, is, you know, maybe we think it's really important, but is that really relevant to the client? So that's something you're wanting to think about with your clients. Accessibility. So 5 of the psychologists spoke to barriers of having their modality accessible to clients with physical mobility limitations. So this is really what we're wanting to think about here Through the Looking Glass, is how we can shift that narrative to think about how clients with physical mobility limitations can also be having access to nature. Similarly, clients with financial barriers, that was a limitation to being able to get clients outside. Some other variant challenges that were spoken to are, if your setting is in a really remote location, what is your access to emergency services? And no matter where you're providing your services outdoors, you're going to want to be aware of where are your emergency services in case something happens, right? Some solutions are to have options of locations for clients with restricted mobility, to follow clients' lead in choosing the route and the pace that you move at when you're outside. 2 people suggested considering consulting with the third party about how to best approach and ensure accessibility, which I hope that we continue to do as an agency here at Through the Looking Glass, you know, consulting with each other about accessibility. You could also consider doing an internal review of the program to make sure that we as an agency have the capacity to handle each of the client's individual needs before accepting them or offering this modality, really making sure that we are prepared to promote safety and well-being for both us as the provider and of our child and families that we're serving. And, you know, I really appreciate this one, to be sure to discontinue the outdoor modality if it would exclude somebody from your group. So really wanting to prioritize that inclusivity. Yeah, so I'm wanting to name that. Here, one clinician spoke to wanting to make sure that even clients who couldn't afford it were able to access their modality. So that person offered scholarships and things like that. So that's something to think about. Not so much relevant to Through the Looking Glass, but in a more private practice model. And then some of the funding was funded by Medicaid, and therefore it was accessible to lower SES clients. So that's definitely something Through the Looking Glass does in merging with Medi-Cal, is that we're able to offer services outside through Medi-Cal. So that's a blessing. And then our last domain that we'll talk about is avoiding harm. So a lot of challenges came up. 6 of the psychologists really spoke to their worries about the additional and the different safety challenges of being outside. You know, the concern that there isn't a current guideline for outdoor treatment in the current APA Code of Ethics. And so while we have these aspirational principles, we don't really have in the way that we have for more multicultural competence and things like that, we have some guidelines and some real supportive offerings through the APA. We don't have that really outlined yet for shifting the treatment outdoors. I do want to name that one of the psychologists hadn't considered their own personal safety when they were outside. So I really want to encourage us to be, you know, not only thinking about how to prepare our clients to go outside, but also to prepare ourselves. And if we have our allergies to bees and things like that, making sure that we have our EpiPen, making sure that our cell phones are charged. Sorry, I'll continue with challenges and then go into those solutions in just a moment. Naming that in graduate training, there's really not training in risk management outside of the office. I mean, I think Through the Looking Glass inherently has us thinking about this because our frame is already non-traditional. We're already going outside of the office and into people's homes. So Rusty and other admin have really done a great job in helping us to think about these ethics. And yeah, and in a way, we're kind of ahead of the curve in that we've already been thinking about this. And so, yeah, we just want to kind of continue and deepen into that thinking about how to protect the safety of our clients and ourselves as we choose to go outside. And yeah, one of the challenges is that treatment outdoors may need to end prematurely, which is okay. If there's any physical barriers, that's okay. If we need to shift back to the phone to protect safety, that's okay. And another clinician spoke to the challenge that there can be some negative and skeptical attitudes of other professionals toward your choice to go outside. And I hope that this training offers you resource to be able to go back to those professionals with more skepticism to say, well, there's actually a lot you can do to prepare to make sure that you do offer an ethical service. So some solutions that were offered, 7 of the psychologists said to really make sure that you're choosing safe environments. 5 of the psychologists emphasized having emergency medical training, which that's not really realistic for us necessarily at Through the Looking Glass, but you do want to have just a basic awareness of what your client's medical needs are and how that could be impacted when you're outside. So day of, you're going to want to assess to make sure your clients have the appropriate gear. Is it rainy? Are they cold? Do they not have safe shoes on? Have they drinking water? You're really wanting to make sure that they have all their needs before you go outside. You could consider consulting with others about how to protect your clients and yourself. And then there were other emergency preparations that were recommended that you can go into the dissertation and tease out all of those details if that's what you're interested in. 3 psychologists said to have an indoor ecotherapy option if your outdoor ecotherapy setting is unsafe, which just means if you do try to go outside with this privilege that Through the Looking Glass is offering us, to have already prepared with your client the possibility that it might not be the best fit and that we might choose to go back to meeting on Zoom or on the phone if that ends up, for whatever reason, being more accessible for your client. So wanting to kind of have these conversations with your clients before you make that decision. You could and should consider doing a medical health history, if not at intake, at this point before you're making that decision about which clients to go outside. 2 psychologists had a liability waiver for that specific decision of the clients to go outside. 2 psychologists emphasized the importance of choosing a location that's not too far from your office. 2 psychologists partnered with other professionals with more outdoor expertise, and that's a little bit more relevant if you're like going on an extensive hike or a backpacking trip or rafting with your clients. 2 psychologists spoke to the importance of following your client's lead for what they feel is safe. 2 psychologists spoke to the importance of staying within your clinical competency. So you might really want to take that big hike with your client, and your client might really want to take that big hike with you. But do you have the medical training in case of an emergency and you fall and break your leg, or your client falls and scrapes their head? Like, are you prepared for that decision? And making sure that you're staying within your clinical competency with every decision that you make in this shift. With child clients, it can be really helpful to have an additional adult and to enroll them into supervision and safety. So having those conversations with your caregivers in advance around how you both want to work together as a team to ensure safety for everybody. And yeah, you can prepare your clients with some activities and safety precautions in advance. And finally, one psychologist said, maybe they wouldn't take litigious clients. One psychologist recommended to have safety certificates. So if you're going to start doing like gardening with your clients, to have them kind of earn a safety certificate for using that shovel, so you can make sure that you feel safe with the outdoor tools that you're going to be using with your clients. One psychologist said that they offered self-defense training to their clinicians. And in this situation, their clients had a history of more dangerous behaviors. And so that was really necessary. And then one psychologist spoke to the hope that APA would create guidelines for clinicians seeing outdoors, which I hope is going to be the foundation from this dissertation to launch into something more formal to break down how we can support safe access to nature in the therapeutic process.
I had
So
a
the goal,
quick question, Rose, on safety. I haven't done, as a therapist, taking kids into wilderness areas, but I used to do it as like, I did life coaching for people with disabilities, and it was a lot of like adolescents and kids. And one thing that would come up, especially with older kids, pre-adolescents, is when it was very obvious that they weren't my kid and I was a male with not my child in public. And it at times attracted attention. And I remember one kid specifically tantrum screaming, "You're not my family, get away from me," just because he had a lot of emotional issues, which definitely brought concern up. And I had to disclose, no, I'm an aide, here's my card.
beautiful.
No one mentioned, like, what do you do if there's safety concerns from others about why you're with this child somewhere? And I was curious if that came up or if you had any thoughts about it.
I have lots of thoughts about it. First of all, just wanting to thank you for your vulnerability and sharing that vignette of a client, and a pretty normal response for the client to say, like, "Hey, wait a minute, who are you? You're not my family. Why am I out here with you?" And so, yeah, it's something that we want to think about, is different reactions that could come up for our clients and how to contain that in a way that okays their different reactions and gives them space to process their reactions. And even better, if you could try to think a little bit preventatively, like, since Dan offered that vignette already, how we can make that plan in advance. So while I don't have a specific suggestion to offer in this moment, I thank you. And maybe if anybody else has a suggestion, or just to know that's an experience that can inform us in thinking further about how to make sure that we have consent from the kids to go outside.
Rose, I have a few things from the chat to put in.
Thank you.
One thing that, one question came up is whether the psychologists in your study did ecotherapy with kids, or this is primarily with their adult clients?
Two worked with kids.
Okay. And another, Stacy commented on an OT in the area, I believe, who works with kids outdoors and, does they'll have I think kids with disabilities and various challenges sometimes have a play partner working on social skills outdoors and things, that his or her practice involves outdoor things.
Wow.
In working with children.
And who offered that?
Stacy.
So Stacy, if you felt comfortable, maybe you could send that out in an email for us to get to look at, how does she advertise herself? How does she have a consent available on her website? And how can we learn from different providers that are already doing this type of work for a long time? Since we're kind of jumping into it in this moment, how can we have these examples like this, this colleague of ours through Stacy? How can we learn and not reinvent the wheel?
And I posted her website link actually in the chat. She's got it's a totally outdoor practice. And so I think she's dedicated outdoor spaces where she has her practice. But yeah, she has an entire kind of treatment approach she calls the Contigo approach, based in outdoor kind of nature-based therapy.
So yeah, I mean, there are so many people that we can really see as role models to this work that we're getting the privilege to dive into together. And, as we move forward with our own research professionally in how to prepare for this work, we might consider looking at that person's website, or through the Looking Glass might consider hiring some like that, or offering more trainings specifically from that OT lens in how to think about how to just really do this on that everyday practical level.
Stacy also earlier in the chat mentioned which I think we're all aware of, that some of our parents are really concerned about mess and dirty stuff or dirt,
Yeah.
dirt play, mud play, things like that. And then Sybil piped in, dirt is good for the immune system.
Yeah, so there's this balance, right, of like helping to re-normalize that we all come from the earth. We're all deeply connected with the earth. Our ancestors worked closely with the earth to provide well-being. Many people still are deeply connected with the earth. You know, farmers give us food because they tend to the land. And so starting with that, and then can you remind me what that share was right before the second share, before Sybil's comment? Oh, the dirtiness. So
aversion to messy dirt.
yeah, I think that's something to really think about. Our families might not have more than 5 outfits to offer the kids, right? And so here we are coming in every Thursday and dirtying and maybe ruining their clothes. And so that's something that we can be thinking about, is how to help the families be prepared for what clothes they have their kids wearing when they come to session. And yeah, just really wanting to come with a lot of openness. And so if you have a client that has that concern, meet your client where they're at and join them in that concern. Think about what other resources you could help them connect with to have a couple extra outfits that could get dirty, or, you know, just really joining them and not shaming them in their worries and not pushing them to make these decisions that really are not in their best interest. Even though we might think it could improve the treatment just a little bit, in what ways would it have a cost? And that's really what we want to weigh with our families and not impose our agenda.
Rusty added in that we need to be mindful, indoors or out, that except for our teachers, clinicians should not be working alone with children, away from parents, other person who can be responsible for them in a medical emergency.
Yeah, I imagine for Rusty, this whole training probably brought up a lot of things that Rusty wants to continue to bring to mind for us. And I think we're so lucky to have Rusty helping us to really think about how to protect ourselves in this decision, because it's not something that it doesn't come without extra liability. And that was one of the topics that with avoiding harm, you know, documentation I didn't get to present about because I didn't have enough time, but you really want to be documenting that informed consent and everything that Rusty just talked about. Can you remind me what Rusty said one more time? I'm so sorry.
About that we shouldn't be alone with clients, away, you know.
Right. So, I mean, that's just the tip of the iceberg, right? It's to really think about where your frame may or may not fit in the shift. So if you have a treatment plan that says that you're going to meet alone with your client without the accompanying of the caregiver, maybe that would have worked on Zoom, but how is that not really going to be feasible now that you're shifting outside? Do you need to enroll the mom to perch 20 feet away reading a book, but be in visual sight of you two? You know, I don't know the exact logistics, and I welcome Rusty.
And I think most of our work we're hoping will be it's parent-child, you know, work, and using the shared experience with nature and new experiences.
Yes, and that's where we really
also a connection with them.
Yes, that's where we're really privileged in our lens, is that we already know that it's the relationship that does the treatment. And so this is nothing new. Our parents are already primed to be enrolled into our treatment. And I think there's other agencies that are going to have a little bit of a harder time thinking about this shift, where I think our agency can really organically enroll the caregivers into joining us in this opportunity. And so thank you for naming that.
So we have 5 more minutes.
Okay, so I think I'm going to close with my goal, of course, was to hope that, as who named so nicely the pendulum?
Which
share? Jessica. So Jessica, so my or Abigail, I'm sorry, I'm forgetting who it was, but whoever it was that spoke to, you know, we have these concerns at the beginning of the presentation. My hopes is, how do I close my friends so I can see my slide? Can you guys see everybody together?
Yeah.
You can?
No. See flowers.
Oh, good. Okay. Let me see here. Pardon me. Okay, so I'm hoping that you now have some more concrete practical solutions for the ethical implementation of this decision to shift outdoors if you choose to at TLG and beyond your work here. And I also welcome if you also feel flooded with worries that you're now gonna take the time to inform and educate yourself about, right? So maybe you're inspired and maybe you're just more aware of the logistics of what you need to do to follow through with your inspiration. And either way, that place is okay. And that's a great place to be for us to continue in our different staff trainings and group supervisions to keep coming together to think about which clients we want to bring outdoors, which wouldn't be a great idea, which maybe not now, but later, or maybe now, but not later, you know, how we can think together and really make good clinically informed decisions about this opportunity. And not just close doors out of fear.
And Rusty says he's been doing outdoor therapeutic work for 50 years and he's including a lot now with COVID. So he's available if anyone wants to consult.
Yeah, so we're really lucky to have Rusty, you know, both with his personal experience and then also with his just ongoing ethical integrity in thinking with us about how to make this decision. So thank you, Rusty, for being an ally and being a consultant that we can turn to be informed that this doesn't be a burden for our agency and for our individual liability, but really be a privilege that we get to offer to our clients. And so I did want to just name really quickly that I have many references, but I have a couple just little things like this book. This book called Ecopsychology is a great book, a great starter book. Ecotherapy is a great book. This is a really great book as providers working with children. This book, Last Child in the Woods, is helping us to think about what are the negative consequences from clients not having that contact with nature. And then I'll end on just little ways that you could buy yourself a book about California flowers and you know, bring that excitement into your work, or rent some books at the library for kids about what to do with leaves and how to make leaf art. And, you know, there's just so many fun things that you can do with this opportunity of being outside with your kids. So thank you for your attention and for your shares, and may we continue to really collaborate and consult with each other about how to make this possible. So thank you for your time. And
thank you. Thank you, Rose.
Thank you.
Thanks, Rose, Evelyn. That was really
Thank you.
Thank you, Rose.
Yeah, lovely. Thank you.
Thank you, Rose. That was beautiful.